So, hello everyone, and welcome. We're going to talk a little bit about interdisciplinary bedside rounding, and that's when we round as a team at the bedside with provider, with bedside nurse, and with other interdisciplinary stakeholders, and we're with the patient and family. I'm delighted to be joined today by Dr. Catherine Silva, who is Assistant Professor of Medicine and the Associate Program Director of the Internal Medicine Residency at the University of Maryland School of Medicine. Dr. Silva, thank you.
Happy to be here.
Great. So today we're going to talk a little bit about interdisciplinary bedside rounding. And I think one of the questions people ask is why do it? And the answer is it does a lot of things and it does them efficiently and quickly. It helps improve the quality of communication among the team. That ensures that we get safer care, fewer adverse events. It creates transparency, so people are pleased and improves the quality of communication. People also ask, is it efficient? And as we said, it is. Multiple studies showing that it has a zero or minimal impact on the length of rounds. And one study that showed that actually dramatically reduced the amount of meeting time weekly as families were happier with the overall quality of communication. I think one of the questions that people frequently ask is, if we're all rounding at the bedside, what does that do to the quality of education?
Well, they've actually done a few studies on this, including surveys, to sort of see what happens to education. And they've actually found that it improves high overall satisfaction. There's preserved quality of education. There's value added by interprofessional input. The patient knows what the plan is for the day, so there's clarity of knowledge there. And there's improved communication among the team members, so your team members will get paged less during the day.
Great. So so one of the things to think about when we are creating processes is what does it look like in your member organization and your unit. So be thinking about whether you're set up for success, things like how are you going to make sure that you're in the right place at the right time, calling ahead to let the unit know, or giving an alert by Tiger or other text. How do you create processes that also make it efficient? One of the things that we talk about a lot is geographic cohorting. So really think about those things as you are setting up your systems. We've really thought about what are the most important elements of bedside rounds. There's a process of all this round a little bit differently, and that's great. There are a couple of key processes to ensure good communication and safety. We've included these. These are on pocket cards and on pamphlets. You can order these through our vendor Web Mason. So I think it's kind of launching into what does it look like when we round? So what does it look like to actually start rounds, Dr. Silva?
So it's very important to set the stage and to go in and have an agenda. So the first thing you're going to do is a brief huddle at the door. Just make sure that there's anything you need to know before you go into the room. And then it's also important to introduce yourself and have team members introduce themselves in the room, as well as to have family and friends who are in the room introduce themselves, and then confirm with the patient that it's okay for the family members to be there. As we said, it's really important to set agenda and expectations. You can let the patient know what the purpose of rounds is. These are supposed to be brief, informal communication to keep the patient in the loop and make sure all the team is in the loop. This is not for long conversations and long involved discussions, as we will discuss later in this presentation. And it's also important to share your assessment and plan for the day. And then ending rounds is important. You're going to do a cross check at the end of rounds to ask the nurse to make sure to see if they have any concerns to be addressed. You can do a read back, which is to review the plan of care and have them tell you what the plan of care is for the day to make sure that everybody is on the same page. And then close by asking if there's any other concerns to address.
I think what's really interesting about the read back is we don't think about the read back as much as other highly reliable processes like aviation. But if you think about when we do ACLS, we're always asking we get a read back on all the orders. And so I think it's really important that as we're wrapping up that we're not only asking, as you mentioned, our colleagues and our nursing colleagues what their questions and care concerns are, but also that we actually have them read that back as part of that safety process. Question for you is, a lot of times patients or families will have a lot of additional questions. We want to keep rounds efficient. What do we do then?
It's okay to use a scripted message, or these are some suggestions here, but remember, it's okay to tell them that you'll come back later and address those concerns. We understand, everyone understands that there's a time period that we have for rounding, and there's a way to strategize that you can both address patient and family concerns and have a concise rounding time.
Great. So I think one thing we talked a lot about is the things that bedside rounding does well and how it works. But I think it's also a good opportunity to talk about what things are not designed for bedside rounding. So I think one is that if we've got some serious or bad news to break, that requires its own special time and place and attention. And I think bedside rounds is not the place for that. I think also that bedside rounds are for concise communication of the daily care plan. They're not for more involved conversations. They're not a replacement for an interdisciplinary conference for especially complex discussions like goals of care. Are there times that we don't want to round at the bedside, Dr. Silva?
Well, occasionally we will run into issues with disruptive or abusive families or behavioral issues related to the patient. And in those cases, it would be better to come up with a strategy to address patient care, to address all the team members' needs that may not involve rounding at the bedside.
And one of the things I'd say also is if you do encounter that situation, make sure to use the workplace violence resources that have been created and reach out to your other colleagues, your stakeholders, to help create those processes rather than just simply not rounding at the bedside. Okay, so I guess it's probably worth talking a little bit more about education as an academically aligned healthcare system. We have a tripartite mission. So what are some of the things that we can do to ensure academic success?
Well, there are a number of things we can do. One of the most important things is sort of keeping track of who's on your team, remembering that you're going to have learners at all different levels of learning. You may have students, you may have residents, you may have other team members, and that everyone's going to have their own educational goals. And you can get some learner buy-in by actually aligning those educational goals with interdisciplinary bedside rounding goals. You can address any concerns before you round, before you even sort of come up with a strategy. It's really important to review roles and expectations at the start of service. Everyone's always more comfortable when they know what is expected of them and they don't feel like they're being put on the spot. You can go through presentation format. I found that going through and explaining exactly what you want in a concise presentation format will limit the time of presentations. You can discuss avoiding or how to explain medical jargon to patients. And you can even go through some strategies for different difficult situations that may arise ahead of time. Again, this will make everyone more comfortable when they're in the room. Another question that educators often ask is, well, how can I teach on rounds? And I have found that just including small pearls of information as you go through related to the patient's clinical course is a great way to educate the team. And you can use discretion to decide if it's best done inside the room with the patient there, or if you're going to teach outside the room.
Great. So what I heard really was creating concise presentation formats helps create more efficiency for trainees. Do you ever actually use a timer or create a timekeeper?
It's certainly an option. Certainly an option to use a timekeeper, depending on how your team is doing.
Great. So Dr. Silva, thank you. I think there's a learning curve for all of us. I think we're all lifelong learners. We really appreciate your interest and dedication to interdisciplinary bedside rounding. If you have any questions, please do reach out to Dr. Silva or to myself. We've included our emails at the bottom, and we thank you all and see you out there rounding.